When faced with a difficult decision, how is it that clinicians are able to decide the best treatment for their patients?
They can do that by gathering evidence that helps to support the different treatment options. A good method often used for that is Pico.
What is Pico?
Pico is a method used to formulate focused clinical questions. This acronym stands for P for patient or population, I for intervention, C for comparison, and O for outcome. For example, here is a patient scenario that may help you understand. Andy is a 21-year-old male who arrives at the dentist for an emergency appointment. He complains of pain and swelling for the past 1 week on his lower left. He admits that he has not been to the dentist in a few years because he is no longer covered by his parents' dental insurance. Examination and x-rays reveal that Andy has severe decay in his lower left second premolar and that it is too extensive to restore with a filling. Andy is given 2 options to address the decay: root canal or extraction. The average cost of a root canal without insurance can range from $900 to $1,100, while the cost of an extraction can range from $240 to $375. At this time, Andy is supporting himself and cannot see any reason to opt for the root canal on a back tooth. He is primarily concerned with getting out of pain as soon as possible. For the population, it is, in other words, patients like yourself. Patients with the same age, ethnicity, gender, medical history, and diagnosis. In this example, the population would be young males with severe decay on posterior teeth. Intervention is also called treatment, prognostic factor, or exposure. This scenario has 2 possible ways to intervene: a root canal or an extraction. We are given further information to compare costs of these interventions. Now we will form a comparison against the intervention. It would be no treatment, or in this case, no extraction and no root canal procedures done. The outcomes in this scenario are decreased pain, improved oral health, and reduced long-term cost. With all of these, you can now create a focused clinical question. In young males with severe decay on posterior teeth, will a root canal, an extraction, or no treatment be more effective in decreasing pain and improving oral health while reducing long-term costs?
Okay, now that we have this question, how do we answer it?
To answer the question, you can 1. Determine your search strategy, where and what you search. 2. Pick search terms from Pico and keep them simple. In this case, we could choose posterior teeth, root canal, extraction, and pain. Then choose your database. PubMed, Web of Science, or HubNet are all good options to use. To help narrow your results, you can filter your results to display randomized controlled trials and systematic reviews for the highest quality research available. You can also use mesh terms like dental caries, toothache, and oral health. Following these steps helps the clinician provide the best treatment for their patient based on evidence. Here are the citations for our project. Thank you for listening.